Haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Hot cross bun sign. So here in hot cross bun sign, it refers to the MRI appearance, and this is nothing but of the pons when the T2 hyperintensity. So this is nothing but appearance of the pons when the T2 hyperintensity forms a cross on the axial images. So cross on the axial images, and it represents a selective degeneration. So selective degeneration is seen, and this is nothing but of the transverse pontocerebellar tracts. So it refers to the MRI appearance on the pons when the T2 hyperintensity it forms a cross on the axial images. It represents a selective degeneration. So there is a selective degeneration, and this is of the transverse pontocerebellar tracts, and also the median pontine raphe nucleus. Next we look at into the pons involvement, and there is also the multiple system atrophy. So multiple system atrophy, this is known as the MSA, and the cerebellar type, it shows the hot cross bun sign. So cerebellar type, it will show the hot cross bun type. To learn and grow daily like this, please do subscribe.